My name is Norm Volsky, your host, and this is the Digital Health Heavyweights podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
Hello, and welcome to the Digital Health Heavyweights podcast with your host, Norm Volsky. And today we are thrilled to have on the podcast co-founder and CEO of XP Health, Antonio Moraes.
Welcome. Thanks for having me, Norm. Thank you.
Excellent. Well, we're really excited to have you on the podcast. For all of our viewers and listeners that aren't as familiar with Antonio and XP Health as I am, XP Health is a vision platform Antonio started in 2018 to combat the cumbersome experiences common with vision insurance. With the help of groundbreaking and award-winning technology, XP Health created the world's first all-in-one vision health platform that makes accessing high-quality vision services more seamless, easy, and affordable. Prior to XP Health, he co-founded Vox Capital, which became a Harvard Business School case study and is internationally recognized as a pioneer impact investing fund, mainly focused on healthcare. Antonio is a co-author and co-producer of A New Capitalism, an international documentary available on Netflix, Amazon Prime, and Google Play. He has been awarded the Goldman Sachs Global Leaders Award and was a member of the World Economic Forum's Global Agenda Council. A native of Sao Paulo, Brazil, Antonio holds a bachelor's degree in business administration and public policy from FGV and a master's degree in business administration and healthcare policy from Stanford. Welcome, and we can't wait to talk all things vision and XP Health.
Awesome. Thank you, Norm.
Absolutely. So walk us through your experience in founding Vox Capital.
Sounds great. I think the two foundational moments for me early on were one kind of a sad story, but when I was 10 years old, I remember the principal of my school came to our classroom and shared the really sad news that our good friend Guilherme passed away in a car accident, almost like the entire family was killed there. And of course, that was very shocking to all of us. So I think that led me to reflect about what is the meaning of being alive? What is the purpose of us being alive if we're so close to being dead, right? And I realized anytime soon, we won't be here anymore, right? So that led me to really think about those things more unconsciously, to the point that when I was 17, I went to a spiritual retreat. And I had a very powerful moment of clarity of purpose, right? Realization of what was, my purpose and what am I supposed to do. So that's one huge influence. The other side is always knew I wanted to be an entrepreneur because my great-great-grandfather was a Portuguese immigrant, came from Portugal to Brazil and started a business that became really large. But I never wanted to be part of the fifth generation. I always wanted to be first generation and create my own thing. So kind of the combination of purpose and entrepreneurship led me and two other co-founders to found Vox Capital, which became one of the very first impact investing funds in Latin America. Even in the world, was still very early on when we started doing that. And the purpose was really to have an impact on 1 million people, invest in companies with great technologies in healthcare, education, financial inclusion that could impact a lot of lives. And the metric was above 1 million lives, right?
That's great. So tell us about Vox's evolution from the early days to what it is today.
Yeah, it was such a grind. I was 21 when we started. My co-founders were a little bit more experienced, but it was a massive challenge to raise the fund and then deploy the funds. We eventually invested in two companies that surpassed that 1 million people goal. So that was very cool, and around healthcare, both. And you shared, it became a Harvard Business School case study. That was very, very happy that that happened, right? Because in the beginning, all your friends and your family, they're all asking what are you doing? Why are you not working in a large bank or large consulting firm or any companies that I can recognize the name? You give your business card and what is this, right? Until after many, many years, I think 6 years for us to really start to get traction and recognition and several awards. Vox Capital became one of We were awarded the top 50 impact investing funds in the world award 4 times in a row, right? So like we were doing something that was right, and people start to recognize little by little.
What's your philosophy when it comes to raising funds?
Wow, it's just a grind. It's just a grind. And I think for VCs is even harder than for startups, but for startups is a massive challenge as well. I would say is just you need to talk to 100 angels, potential investors to get one. So it's even harder than sales. It's like a sales process, but with lower win rates, resilience, perseverance.
Yeah, that's great. What was the mission of Vox? And we know that you went out to build scalable solutions to enhance the lives of low-income Brazilians. Can you tell us about some of those success stories, some of those companies that did reach over 1 million patients?
Yes. So, for example, one was a medical device company. They created lung ventilators. That was 2012, I want to say, when we invested. And lung ventilators became one of the most critical solutions during COVID-19.
Yeah,
right?
absolutely.
So they started to have a lot of success even before that. They dominated the market in Brazil, started to export to the US and Europe. And it was a 30% cheaper solution with the same quality, with lower volume. So easier for ambulances and like ER departments to just have the solution. So, right, like a technical innovation and perfect go-to-market execution, incredible company. So I think that's the kind of philosophy that we had in Vox Capital back there in the day, like technologies that can save lives or substantially improve lives while making money, right? They're businesses, right? That's the approach.
Yeah, absolutely. So, what were your greatest learnings from leading Vox? And tell our viewers what Harvard was trying to learn from the Vox story with the HBS study.
That's a great question. I think biggest learning for me it's very hard to find product market fit. It's very easy to come up with ideas. Like you have smart people around and you have amazing ideas. When you go and you face the market, like Mike Tyson shared, you have the gloves there. When your ideas face reality, like you're pushed.
Yeah, what happens when you get punched in the mouth is the
Yes.
quote from
Yes.
Mike Tyson.
Exactly.
Everyone has a plan until you get punched in the mouth.
Yes, that's the call. Exactly.
Yeah.
So I think that's the biggest learning, right? It's very hard. And you need to talk to customers. You need to solve real problems. And here in Silicon Valley, like we're here, there's a lot of money that goes towards solutions for problems that do not exist, right? So you need to be very careful with that.
Yeah. You are also the co-author and co-producer of A New Capitalism. For our listeners, it is available on Netflix and Amazon. For those who haven't seen it yet, what is the fundamental message of entrepreneurs building more human capitalism focused on profitable business and fighting poverty?
Yeah, I'm one of those unreasonable, kind of crazy people that just like, so I put in my mind when I was still in college, my second year of college, that I wanted to go to India, wanted to meet entrepreneurs creating massive social impact, impacting the base of the pyramid, like the poorest of the poor, with business models that were profitable and scaling. So that's what we did, and it became a feature-length documentary. Eventually, we sold to Netflix. It's not on Netflix anymore. I think they replaced with the Octopus Teacher or something like that, like a better documentary. But I was very proud. It took us 10 years during my weekends with the team to produce, create the script, record many different countries around the world. And the main message is you don't need to choose between profit and purpose necessarily. Some businesses will need to make that choice, but many times you can create a business model that the more scale and economic accomplishment that you have, the more impact you're generating to society, right? And then we recorded those stories telling how capitalism is evolving to something that is more sustainable, more inclusive, and there's the option, right? Not everyone is focused on that. And it's the same thing for us as human beings. Like, what is our purpose? Is it purely the homo economicus? Like, our purpose is to make money. And then again, one day we're dead and like, we're not bringing anything with us, versus a combination of different things, right? Like, I want to make money. I want to pay a great education to my kids, but with a focus on a purpose, right?
Yep. Yeah, and that's the great thing about, working in this industry is, everyone in digital health has and should have a purpose, that's focused on more than just financial gain. And, that's what I think is so great about our space is no one starts these companies trying to make as much money as possible. Because if they did, they would, build consumer apps that, are social networks because those tend to be the highest upside ones. But instead they choose something that still has opportunity for great financial impact, but more of like a great impact for patients and people at large. So, what inspired you to found XP with James Wan after running a very successful VC?
So great question. So I was both of us, my co-founder James and we were at Stanford. We were doing our masters.
Mm-hmm.
We met, we applied to this very hard entrepreneurship class called Lean Launchpad. And it was one of the toughest to get in, definitely one of the toughest to get out. So we had to do 120 interviews with potential clients and customers in 10 weeks, like a massive grind. And you were pushed to go out like on the streets and just talk to people. And then we pivoted 4 times from the original idea was a medical device to screen for cataracts, the eye disease. And no one cared about that. Everyone hated the idea. No one wanted to pay for it. And we got a lot of pushback from the professors, like, hey, it's great to hear when your ideas suck. That was the main message that we got. So we continued to pivot very fast. And until we figure out that vision insurance and vision care has really low NPS, net promoter scores. It's usually a negative.
For those who are not familiar with NPS, it's like client satisfaction scores.
Yes. And they go from minus 100 to plus 100. For example, healthcare overall, you might know this even better than I, Norm, seems to be around 40 last time that I checked. For vision,
at least it's in the positives. That's a little surprising.
It's a low positive, still positive. Vision insurance, every time that we track with our clients, a traditional vision insurance has a negative NPS, right? Has been ranging around -8. And at the same time is very concentrated, few monopolies, right? Like not even an oligopoly. And nothing has happened for decades. There's no innovation happening, right? On the vision insurance side and on the benefit side. And for example, the personal experience that James had, he was my co-founder at Facebook, Airbnb. He was a top machine learning engineer, 13 patents. He had really great benefits, as you can imagine. But when it came to vision, every time he was spending close to $300 out of pocket after insurance. A friend of mine, Fortune 5 tech company, amazing benefits, came to me, said, Antonio, I just spent $800 after vision insurance. Well, what is happening? So what happened is we traveled to China. We found the manufacturing companies that are making the Ray-Bans and Tom Fords and Gucci's and all the lenses as well. And what happens is something that retails for $500. Let's say like a really nice pair of Tom Ford frames. They cost $7 to $11 to be made. Right. And the lenses that retail for $300, $400, they cost $5 to be made. There's like a massive markup on the.
But that's a good margin business. I think VCs would love those margins.
Exactly. Although we're flipping the entire script on its head, because we don't make money on the eyewear side. We make money on the subscription that employers pay us. And then the members can really save 70% or even 100% of the cost many times.
That's great. You have the goal of impacting 1 billion people, which is like 3 times the amount approximately of people living in the US. So like you want to go international. What is the problem with traditional eye care experiences, not only in the US, but internationally? And how is XP looking to solve that?
Yeah, so first, the purpose of a billion people, which is ludicrous. I know it's crazy, but
No,
I
nothing's
don't care.
crazy unless you believe it. But if you think it's
Exactly.
possible, then you got to go out and make it happen and prove it.
Yeah, the thing, when I was 20, I set myself the goal of achieving 1 million people impacted. No one believed, right? And then when I was 28, 29, I was like, okay, check. Like, so let's, in Silicon Valley, they push you to think even bigger, right? So I said, okay, it's very hard, but might as well do it because the cost of dreaming big and small is the same, right?
Yes,
So
correct.
anyway, in terms of vision, there's 1 billion people, even more, in the world that don't have money to pay for a basic pair of glasses. So they might be not seeing well, like in school, for example, like my daughters, for example, we would be impacted if you cannot see the teacher and everything. At the same time, when we think here in the US, people are spending $800 on one pair of glasses after vision insurance on something that really cost the materials cost is $15. So to me, that's outrageous, right? That we have this disparity. So the hypothesis that we have, and still we're very far away from 1 billion people, is can we build AI, really cutting edge technologies that can be super scalable at a fraction of the cost, or even sponsored by companies, by governments, so everyone can have access to, like, imagine an eye doctor in your pocket, available for free 24/7, right? And with the current technology, it's already possible to dream about that.
Yeah. And walk us through the experience of an XP Health as a member and as an employee.
Perfect. At XP Health, we're reducing cost by 70%. We're increasing NPS, the Net Promoter Score, client satisfaction, by 70 points. So how we do it, the experience is you can go in person and get an eye exam. We have a network of 99,000 provider combinations. And then you also have a discount, typically 35% discount on the eyewear in store. Where your dollars will go much further is with the online platform that we built. And then we have a direct from manufacturing type of model whereby our members, they can get the price that cost us when we are acquiring the frames, the lenses from the manufacturing companies, right? So, and we have all sorts of top brands, all the best brands that you can think of, Ray-Ban, Tom Ford, Oakley, Gucci, Yves Saint Laurent, like all the major brands, and plus the other ones that you never heard about, but they cost the same thing, same quality coming from the same factories, right? So that's the model. You save a lot of money. So, for example, we have
Approximately percentage. What's the percentage that an employee saves on like a name brand, designer brand?
like 60 to 70%, depending on the.
Wow,
Yeah.
that's incredible. I thought I had a good deal at my club getting 40% off on Maui Gym and a couple others. 70%, like that's a real employee benefit. You can't get that anywhere else.
Yep. And we have 800 frames that are at zero cost. So like fully paid by your employer. So
Yep.
imagine high quality frames. If you don't really care about the brands, it's gonna cost you zero for the frames, zero for the doctor recommended lenses with all the coatings, and then zero for the exams, right? And
It's incredible.
that's how it should be.
Yeah, absolutely. So walk us through how XP saves the employer money as well.
Because the economics are much better, we are bypassing a number of intermediaries. When you look at the global economics, we're saving a lot on the costs, right? Because of the model. So then the employer can decide, I want to share the savings with my employees, 100% of it, or let's reduce the total cost for the employer. So it's usually a decision. Most of them, they say, just match the price of what I'm paying today with a traditional vision plan,
Mm-hmm.
and just give me the absolute best. So sometimes some clients, they want a really luxury plan, and the cost is even 5 times higher than a traditional plan that has really low value. Well, when you show value, many times you're selling at a higher price as well. Is it for everyone? No. And we can also save costs to the employer, but because of the economics, right, the ROI is much, much.
Great. Can you walk us through just, early days of XP to now of growth and, how many employer customers you've been able to bring in to, the customer list and, how much you've already scaled the company so far?
Yes, it's a great question because we started the company before the pandemic,
Mm-hmm.
and we were doing on-site vision care. So I was driving a van with my co-founder when we really started, and bringing an eye doctor with doing a comprehensive eye exam
Yep.
inside offices around the Bay Area here,
Mm-hmm.
how we started, and providing the glasses, including like the finished glasses with the lenses.
Mm-hmm.
Within 1 hour, you had the whole thing. That was great. We raised our pre-seed and seed rounds. And then the pandemic came, hit us, completely disrupted that business model, as you can imagine.
Yep.
So we had to completely pivot. We let go almost every employee in the company, went back to my garage. I have the pictures, the videos when we were there, like, 11 p.m., all dark, trying to figure out what to do. The investors calling us and putting a lot of pressure, right? Like, what are you going to do? So then we found a digital first approach. That's how then we started to grow. So for example, 3 years ago, we had 30 clients when we launched this new model. DocuSign was probably the largest. And now we grew to 3,000 clients, a
Wow.
number of Fortune 500 companies, also insurance carriers, TPAs, GAs as distribution channels, a lot of brokers as well. So it's becoming more and more the gold standard, I would say, and things are moving very fast, thankfully.
That's fantastic. So, like, what at the time was probably extremely scary actually created the innovation that was probably needed to make your company as scalable as it is today.
Yes, it was daunting, Norm. And I remembered my meditation. I meditate every
Uh-huh.
day, and I track with Apple Health. The number of meditation minutes just went through the roof throughout the pandemic while we were pivoting, and when we were running out of money many years ago as well. So I was meditating over 1 hour every day, right?
Mhm.
So it was super tough. And then I'm really glad. I think the methodology that we learned during the Stanford class, the Lean Launchpad class, to really go out to the street and interview people, understand what are the unmet needs, that really saved us.
Yeah. I know a handful of your employees. You got some really, really good talent at your company. What's your philosophy on, building great teams and attracting top talent?
Number one, I'm very I'm very harsh about this. I have a no assholes policy.
That's a
A
good thing.
person can be a great performer. It's not for us. I don't subscribe to the philosophy that you need to be an asshole to be great, right? Involves a ton of hard work,
Hmm.
innovation, scrappiness, but also humility. So I think the great examples of some of the tech founders that we know, I think is like despite of the person being sometimes like prick, etc., they were massively successful because they were geniuses in many different dimensions, right?
Hmm.
But there's several great leaders that are very inspirational,
Hmm.
and they're not assholes. So that's the number one. I think like humility is one of the core central values that we have. If we have our egos in check, everything is just easier. If our egos are mandating what we should do, we're not listening to data, we're not
Hmm.
listening to our customers. Like what matters is like what is my opinion, right? And who speaks louder or who has the highest level in the hierarchy.
Yep. And in terms of like interviewing and like identifying great people, what are you looking for when you interview other than, having humility and not being an asshole?
Um, just like overall A players. I'm looking for like 10x players, right? So when you think engineers, there are 10x engineers and they're producing massive results. So we are in Silicon Valley. So on the engineering product design teams,
Mm-hmm.
we're really looking for the best around people coming from Stanford, from big tech companies, or just like big hustlers. We're not like, we don't care about the credentials, right?
Yep.
Um, so just like hardworking, obsessed about the customer, about our problem that we're trying to solve, right?
Mm-hmm.
So we're very particular about culture. So I think it's a combination of hardworking with humility, being scrappy, being able to be in an environment that is very fast moving, right? And so typically coming from a really large company, it's something that is hard to see a great fit.
Yeah, absolutely. Something else I love about your company is you're trying to displace a couple of huge organizations that have been around for a very long time that, like you said, have pretty much a monopoly on the market. What I love about you, and I've known you for years now, is you didn't just try to poach people from companies, that you were chasing, like VSP and others, because you're like, well, I don't want people from there. Like, we need to sell something that's different. Like, I'm not just trying to like do the same thing, and necessarily pull some of their people over and just create another one of them. You've wanted to get people from outside the industry that think differently. Can you walk a little bit through like your thought process around that? Because I think it's really, really, and I admire it, and I think a lot of CEOs could really learn from, like, hey, poaching from your competitors isn't always the best route to go. There's a better way a lot of the time, and I think the way you thought about it was like really, really strategic.
Great. I think the main thing is thinking from, of course, like our competitors are not technology companies. So on the engineering side, obviously doesn't make sense. It could make sense on the sales side, right? Because supposedly
Mm-hmm.
they know how to sell a vision product, despite of us not being insurance, being a technology, right,
Mm-hmm.
company with a digital approach. The main difference I feel, Norm, is if you're used to selling only products that have a great brand, right, that they have been known for years, it's a very different type of sales, right? When you're coming from a startup or scale up that few people have heard about, has an amazing solution that is 10 times better, but no one heard about, it's a very different type of sales, right? So that's why like we really like people here on the sales marketing side, people that have crossed the chasm. We're trying to find product market fit. We're trying to create a brand, and we're able to be successful with the innovation, but despite of people not knowing about the brand of the company.
Yeah. I love it. Like, you wanted to do something different. You didn't want to continue doing things how they're currently done. You wanted to do things like a new way, how it should be done. And, going to companies that have done it the same way for 50 years is probably not where you're going to find like truly innovative thinkers and people that, can articulate that vision. Also culture is super important. You mentioned that earlier. Obviously, building a great culture is a lot easier when you have nice, caring people within the organizations and you don't bring any jerks, into the fold. Talk to me a little bit more about like how you look about, building culture and how you've built, a great culture at XP.
I think building culture is making like tough decisions. Like one, being very particular about like who you bring in the bus, but
Hmm.
also having the wrong people off the bus, right? And then to me is having a broad picture of where you're going. But if you do have a great team, then you're figuring out throughout the way. So I'm not the type of leader that is top down. Here's the everything that you need to do. I'm empowering people. Like Apple, for example, they say we're hiring people to tell us, or maybe it's Google. We hire people to tell us what to do, right? And Steve Jobs used to say, like, if you have even one B player in the team, then you're like everyone is being dragged down, right? So you need to be very particular about that.
You get what you tolerate in organizations. If you tolerate work at this level, that's what you're going to get. If you like only tolerate this, you get that gravitational pull towards the mean.
Exactly. Of course, it depends, like, who are you calling like B players, right? Not everyone will have the most massive potential, and sometimes they're like great executioners with, within a certain level of ambition, right? Not everyone needs to be the next CEO.
Yeah, absolutely. So XP Health has raised over $55 million from some of the top venture firms, in our space, big fans of some of the firms that you've worked with. As someone who's built a venture fund personally, what would you say to a founder going out to pitch a venture firm in this unique environment? And just any tips of founders looking to raise money right now?
I think it's the same experience that I had when I was 21 raising the venture capital firm. It's just a grind. And
Yeah.
especially in the beginning, is even more. So I would say to other founders, it gets easier over time because then you start to form a network, and you have more funds that are later stage. Assuming you have results to show, then it gets easier, right? But just assume you need to talk to 150, even more, to have a buffer. 150 investors to get your first check. Just
And
continue.
why is that? Why do you believe that's the case?
In the beginning, you don't know exactly the preferences of each one of the investors. So, for example, you burn a lot of calories talking to investors that have nothing to do. And also, you're finding product market fit. You don't know exactly if you're going to be a SaaS business or an AI business in healthcare or purely tech-enabled service, right? So I think that's one you're just unfocused and you're talking to everyone until you figure out like the ones who click. And there's a lot of competition. There's like thousands of startups just here in Silicon Valley and across the US, across the world, millions of startups. And I think it's hard. It became, after being an investor as well, it's very hard to figure out who's going to be successful. So you see a slide deck, it's very hard to predict. The best predictor is how relentless is the entrepreneur. So show me results. Even in a pre-seed, you need to show traction already, right? We have X number of pilots, and the pilots went well, and the investors want to really reduce the risk as much as they can. So I think that's the challenge.
What mistakes have you seen founders make when pitching you when you were on the VC side that you would tell most founders to avoid? And, those are usually not great things to do in one of these investor pitches.
I've done all of those mistakes as well 100 times. I think the biggest one, most common, is not knowing exactly what are the preferences of that investor. If they're specialized in consumer and you have an enterprise business, just don't bother. And founders, we're all optimistic, so if like maybe they'll buy the idea. No, you're just burning calories, just wasting
And they
time.
won't be strategic. Like if all their knowledge is consumer and you're selling B2B, like all of the relationships and all their knowledge is not going to be transferable. They're not going to be able to add any value. So, I think for founders, like you want to meet strategic investors that bring something to the table themselves that might, help your business grow also.
Exactly. And also they understand it. If they can bring value, it's because they understand your industry. And then it's a better fit and it has a strategic value, as you're saying, right? So some of our best investors are the ones that really understand the industry. They can make introductions, they can like push you in the right direction.
Yep. How do you see AI impacting the digital health world? That's like the billion-dollar question, maybe
I'm
trillion-dollar question.
trillion for sure. I'm very optimistic. We're building a lot of AI features. Since we found the company, we always had the hypothesis of using AI, cutting edge technologies to achieve massive scale and impact, right? And now more than ever with LLMs, Gen AI, we see a lot of applications. The obvious one is on the customer support level, right? I've seen interesting applications that you have more consistency, you have 24/7 availability, the AI doesn't get, is always patient, doesn't get frustrated because you're keeping asking the same questions all over again. So on the admin side of things, right, I think there's a lot of efficiencies there to be captured. A bit harder on the healthcare side in terms of like diagnosis, for example, but it's gonna get there as well.
How do you see emerging technologies impacting what XP does over the next handful of years to improve member experience?
Oh, there's a lot of confidential stuff in our product roadmap that wouldn't be able to share, but I would say the things that we're working on in terms of Gen AI and overall AI is to bring more convenience, to reduce cost, make things just easier, faster, and very, very personalized. So I think that's like the broad strokes. These are the main themes, the benefits of Gen AI and for a company like ours in our space, in the vision space.
That's great. Just out of curiosity, obviously, like a lot of people wear glasses, but also a lot of people that have vision needs also wear contacts. Does XP do anything or will they do anything on the contact side?
We do everything from prescription glasses to contact lenses, sunglasses, non-prescription computer glasses as well. So when we're talking to an employer, it's really 100% of the population can benefit.
Yeah. Walk us through the contact lens version of, your product suite.
So I mentioned there's a plan design that you're able to get frames for $0, doctor recommended lenses for $0, the exam for $0, and then contact lenses, it's at wholesale price, which means you're saving money. It's pretty much like less expensive than Costco. That's our
good.
target. Costco is consistently the lowest cost in most cases.
I should know this. I call 1-800 contacts every year to restart, and I always say, "Hey, can you price match with?" And I usually say Walmart. Now I'll say Costco going forward.
Costco is statistically a little bit lower price than Walmart from what we've seen.
Okay.
So we target Costco,
We're
but
talking
even
about tens of dollars. Like I'll survive,
yes,
but it
yes.
always is good.
Exactly. So our members, the cool innovation that we brought this year is you don't need to choose between using your benefit towards glasses or contacts, because there's 25% of the US population that uses contacts, and then in a traditional insurance plan, vision insurance plan, you need to choose between either glasses or contacts. In our case, you get both, and in many cases, a pair of sunglasses as well. So that's pretty cool.
I like that. So you've been a founder, pitched probably hundreds of times as a founder. And then as a VC, you've probably seen hundreds, if not over 1,000, pitches from CEOs and founders to you. Walk me through just what you think is really important about a founder, and what characteristics do most successful ones have in common? Other than persistence, which you mentioned is probably the most important thing.
Yes, I was going to mention persistence again. I always think it's resilience and seeing a lot of different cases, because bad things will happen always, and you just
life.
need to survive to live the next day. That's a lot. That's life, exactly. I think other than that, I think it's being able to work with amazing people, like selling a big dream, right? That motivates great talent, great investors. Because to me, there's a flywheel, right? You bring money to hire great people to build a great product. So then you can generate revenues, of course, to bring more investors, more capital, to bring more great people, even greater people, to build an even greater product, right? So to me, that's really like, and the crux for everything is being able to sell a dream, right? And convince people that you're in the borderline of, being crazy and being a visionary, right? So
Yeah, no, you got to do what a lot of people don't think is possible to achieve amazing things. It's funny, I've in the last, and I don't know if I've talked about this on the podcast yet, I've started an early stage investor network within the
Oh,
digital health
wow.
space. Now we have over 400 members, and I'm running this with Jason Perot, who's been on the podcast before, longtime benefits luminary, AT&T and T and Boeing, head benefits and now at Vita Health and one of the founding members of EHIR. And then Jason McAleer, who ran commercial go-to-market for employer at Livongo and Teladoc. Post-merger, he did both, and then was CCO at Transcarent for the last handful of years. But anyways, people are like, Norm, like you're a recruiter. Talk to me about like what qualifies you to be an investor. And then I explained like all that I've done personally in the last 5 years and, what I've seen and some pattern recognition and different things. And, people are still a little bit like questioning, like, hey, do you have what it takes? And, I'm excited to prove everyone right that, believes in what we're doing and also prove to the people that don't that we have what it takes to be, really, really great early stage investors. So anyways, you got to try new things and you got to get out of your comfort zone. No one's ever going to nominate you for something, that you want to achieve. If you haven't done it before, you kind of got to do it yourself. So I think that is very, very true in what you said. I think in healthcare, it's really important. Us leaders like really practice what we preach. So live, breathe, sleep your business. Vision care is definitely a part of overall healthcare. How do you participate like in this industry from a personal standpoint? You're in a very stressful job. You mentioned a lot of investor pressure. What are your favorite ways to reduce stress and exercise? You mentioned meditation, but what else do you do to kind of stay clear-headed?
Yeah, my go-to is really meditation, I would say. Family time, right? Like you don't have time for much else, right? So you need to choose. And our entire families, me and my wife, are all in Brazil, so we miss them.
Mm-hmm.
But it's a choice, and being here in Silicon Valley with no family around, it gives us a lot of silence to focus, right? So I think that definitely helps. So it's life decisions are hard, but if you want to build something, right, and something that is a challenging thing to do, you really need to focus.
Mm-hmm.
But I would say meditation is always my go-to. As I mentioned, the stress level goes up. Meditation minutes goes through the roof as well. I highly recommend. And I did 4 classes when I was doing my master's at Stanford at the medical school, not the tree hugging school, right? So there's a lot of medical evidence around meditation and mindfulness that are highly recommended.
That's great. And then, I think another huge piece of healthcare is what we're putting into our bodies, what we're eating day to day. Are there any healthy recipes that you and your wife make at home that keep you running full efficiency and, making sure your body is fueled with a lot of, good energy that you can devote to XP?
That's a great thing. My wife just found a great app. I'll do the plug here. No commissions.
Please.
I should, but it's called Yuka. I don't know if you heard about it, Norm.
I have
Y
not. Let's hear about it.
Yuka. And it
Okay.
basically you can scan the barcodes of like all the different items and gives you a very precise, very scientific based description of the quality of the food or like cosmetics as well. So I found my deodorant, which I used to buy on Amazon like all the time, has a 0 out of 100 score because of all like aluminum, like all the terrible stuff. And we're doing this with food, and we just replaced a number of things, and we go to Trader Joe's and we're
Well,
just
Antonio, the best thing you can do for food is things that don't have a barcode. They're just a vegetable or a fruit.
yes, exactly. For the ones that need to have a barcode, then I highly recommend Yuka. But I avoid like white carbs, try to do fasting, intermittent fasting. It gives me still a lot of headaches, so I struggle, but I try to do once per week at
That's
least.
great.
Yeah.
Love it. Well, again, Antonio, thank you so much for joining us on the Digital Health Heavyweights podcast. We're a big fan of you and XP Health, and we're excited to see what you and your company accomplish over the coming, handful of years. You're at 3,000 customers today. Let's get 30,000 by the next time we do one of these.
Amazing, Norm. Thank you so much. It was a pleasure to
Thank
be
you.
here with you.
Take care. Please like, comment, and subscribe below. This is the Digital Health Heavyweights Podcast.